first of all, I'd like to ask you permission to use this video for educational purpose on the internet.
Yes.
Let's go to the what the problem is, because your problem is not a small one. It's a big problem.
Right.
You have what we call, when you're laying down even, you have this scoliosis, which is almost getting to 35 to 40 degree. When you stand up, it gets even worse. And with all the twists that your back make, and practically make your spine in a very pathologic, in a very twisted way. And I cannot imagine this is not painful. I cannot imagine. Tell me about your pain. Tell
My
me how
pain is a 10 out of 10 every day from the time I get up till I go to bed. And I'm on pain medications. It really doesn't help much.
Yeah.
And when I stand up, I can't stand more than 30 seconds without it. Just, I cannot do it. I have to bend forward to release the pressure from my low back. It feels like a knife that's just jabbing my back. And it's coming through my stomach. And that's how it feels. And it goes down my legs, into my feet. My feet are numb. My hands are numb and tingling.
So this pain you in the back and the leg, how long have you had it?
10 plus years.
10 plus years. And you have been just, you have been doctoring around for this.
Yes.
We don't need to know the name, but what did the other doctor tell you regarding what the problem is and how they are going to deal with that?
I just had a stimulator placed in my back.
Yeah.
And the doctor that did it crossed his arms and he said, Bev, don't ever expect me to do surgery on your back, because I won't, because you're too high a risk. You'd be under anesthesia too long and you wouldn't make it. And he sent me out the door.
Yeah. He asked you to go and live with this.
Go
put
about your life. You have the stimulator now, that's gonna fix it, and it didn't.
Now we know that if you have so much structural damage, stimulation device won't be able to mask it. And for people who don't know that, the stimulation device is like, the pain is a noise of a smoke alarm that there's a fire in your back.
Yes.
And the stimulation device is like resetting that smoke alarm button so you don't hear the noise. It doesn't fix the problem. In some cases, it makes you not hear the noise of the smoke alarm or the pain, but your problem is way beyond that. So this is not livable.
No.
You told me something about that, how bad your pain is.
My pain is so bad on a daily basis. If I have to live like this the rest of my life, I'd rather die. That's how bad it is, because I don't have a quality of life. I don't have a life. I can't do the things I used to do. So I'd rather die.
Yeah, well, the good news is you don't have to die. You're in the right place. You're the typical patient we treat. You have a good track record. That doctor is right. That surgery, open old-fashioned way, is too long, too bloody. You may lose the entire blood of your body in that surgery. When we do this surgery, we do it in about 2 to 2.5 hours. Our patients are discharged usually within a day or two. This is statistic, obviously. Obviously, no surgery ever come free of risk. No surgery ever come with a guarantee.
Right.
But we have a statistic. We do this surgery in 2 to 2.5 hours, and the patient mostly in a day or two home. And our patient within a month or two are able to do basic things, and we have a good track record and lots of testimonial of the patient who have gone through that. So you don't have to die. We will give you the best we can, and even though we cannot deliver any promise of any kind, we have a good track record helping exactly people like you in this situation. And I think it is reasonable for a surgeon to tell the patient that this surgery is too dangerous in my hand, I'm not going to do that. But the next step is not to say, go live with it. The next step is finding who can help you and refer the patient out to somebody who can help you, because you described that pain with a knife in your back.
Yes.
Nobody should live with that.
No. And you know, Dr. Bassi, I looked for you for over 2 years till I read your history. I read so much on you that the only reason I'm here is I'm comfortable with you as my doctor, and I trust you.
Thank you. And I put testimonials like that, before the surgery, after the surgery, 6 months after the surgery, a year after the surgery, I can show that I have a track record helping people in your situation. So you're in the right place. You don't have to live with this pain, and we do our best to fix it for you. Okay?
I'm grateful for you.
Thank you. I appreciate
God
it. I
bless.
appreciate that.